On this episode, we'll talk about heartburn, dizziness after your surgery, and hiatal hernias. Hello everyone, welcome to episode 14 of the Ask Dr. A show. I'm excited to be here back home, and we have a whole bunch of questions. We're going to be spreading these questions for the next episodes, but this episode we got really good questions, and we're going to be talking about the heartburn, as I mentioned, dizziness after surgery, which is really common. And we're also going to be talking about the hiatal hernia, if you can have the sleeve done or not. So let's get into the questions.
I have developed almost constant heartburn. I took Omeprazole and the heartburn is a little bit better. Will I need to take medication forever?
Yes, okay, so having heartburn is common, especially with patients having heartburn before surgery. So if you have heartburn before surgery, it'll probably continue for a while after. Now, normally the acid production of the stomach increases after the sleeve, so you will have to take some antacids for a while. Sometimes it's a few days, sometimes a few months, and sometimes it may be a couple of years, but then this acid production normally lowers as the years go by. So is it mandatory to take the acid blockers forever? The answer is no. We'll have to go as we see, and normally it's a few weeks to a few months.
I have occasional dizzy spells due to low blood pressure. Causes and remedies?
Alright, so being dizzy after surgery is really common, and this is because your body is adjusting to the new you. And this is common through those first few months after surgery. Why? Because your body is changing, becoming smaller. So your cardiovascular system, your heart, your lungs, the amount of blood, the amount of fluid in your body, all these systems have to adjust to the new you. And once it adjusts, your body still keeps changing, so you may continue having these dizzy spells. They're normal, nothing to do about it, just to avoid really rapid movements from being laying down for a while, standing up really quick, or tying your shoelaces and then getting up really quick. Rapid movements will trigger these dizzy spells, which not everybody gets. But if you do, try to avoid those movements. Nothing to do. They will go away once your body adjusts and once you're stabilized and you're not losing any more weight. Months down the road, maybe 12, 18 months down the road.
Are you still able to VSG if you have a hernia?
All right, are you a candidate if you have a hiatal hernia? The answer is yes. Actually, most of our patients don't even know they have a hiatal hernia, and 3 to 4 out of 10 patients that go in for a gastric sleeve, they have no idea they have a hiatal hernia. They have some indigestion, some heartburn. We go in and we find this hiatal hernia. What do? We fix that hiatal hernia. In our case, we don't charge extra, so patients get a 2-for-1 bundle here. But the idea is to fix it since we're already there. We fix the hiatal hernia and we do the sleeve in one step. So yes, you are a candidate if you do have a hiatal hernia. It is possible, of course, and patients do really well. Heartburn gets taken care of, and you get your gastric sleeve that you'll start losing weight to. So there you have it for episode 14. Thank you so much for submitting your questions. Don't forget to use the hashtag AskDrA, and don't forget to subscribe, all right? So You have the social media accounts that you can follow us. I'm Dr. Alvarez from Endobariatric.com, and the question for today is, have you had dizzy spells while you lost some weight? The answer is yes, no. Down below, I want to hear from you. I'll see you in episode 15.